Okay, very good. Well, good morning, everybody. Thank you for joining us today. We have a unique pleasure of having Dr. Mauricio Percovich, I'm probably not pronouncing that right, from Montevideo, Uruguay, give us a lecture on ENT training in Uruguay and patient care and infrastructure. My only knowledge of Uruguay basically consists of some knowledge of the German government was building a plant in Uruguay in the 40s to make what's called heavy water, which was to be shipped to Bariloche, Argentina, for the purpose of making nuclear bombs. Now, this is what I read. If it's true, please verify it. Anyhow, we're looking forward today to have Mauricio talk to us. It's a very small country. He'll tell us about it. But as far as I know, they're very advanced in their ENT training and especially otology. So Mauricio, thank you very much for joining us today.
Okay, thank you, Richard, for the invitation. And I want to speak very slow because my English is basic, okay?
Perfect. Okay, Mauricio, you're on.
Okay, so we are going to speak a little about the healthcare system and ENT formation here in Uruguay. This is our flag, of course, from our country. And to start, a very short things about our population and things. Uruguay is a small country, of course. We have a population of 400 million. The capital city is Montevideo, and our surface is 1,078 square kilometers, okay? And we are between Argentina and Brazil that are, for us, two monster of countries, because Argentina have 2 million square kilometers and 40 million people, and Brazil 8 million square kilometers and 220 million people, a lot of people there. We are only 3 million, okay? We have 18 departments, and the capital is here in Montevideo, on the coast. And the mostly population is here in Montevideo. We are 3 million, 1.5 million live in Montevideo, and the other rest live in the other departments of Uruguay. So we are concentrated here in Montevideo. The majority of things are here, okay? What we have a very large coast, 600 kilometers of coast with a lot of beaches and things and cities like Punta del Este, that is the photo here. And we have 3 million tourists per year in Uruguay. And what we have most is cows. 11 million of cows, because we have a lot of countryside, okay? So the conclusion of this picture is that our incomes is based on the exportation of meat and from tourism, okay? That was a little introduction of our country that I think it's okay, okay? And now I want to start, I want to explain the system of national health system here, but it's very difficult because it's different from the other countries here in South America and the most of countries, because it's like a solidary system, okay? The name translated to English is Integrated National Health System. Integrated because include all the people who live here in Uruguay. The Uruguayan and the immigrants who live here have the identification form part of the national health system. Okay, and all this system is regulated by the Ministry of Public Health. Okay, regulated and administrated. Okay, and it's very difficult and cost a lot of money for do this. And the question is how we do that for all people who live here to have a good health system with money, reserve fund. They need incomes of money to have the system good, okay? So everybody who works in Uruguay, the people who works have a tax of 6% of the salary to use in the national health system when they live alone. But for example, if they live with children, they pay 6.5% of the salary. And if they live with children and with a wife or husband, pay 8% of the salary. That it's a lot of money when you have a good income. But when you have a bad income, it's not enough. So they need more money from another sides. But the principle to understand is that everybody have a health system attention. Okay, nobody, including the people who live in the street, can go to the hospital and have a good attention. Okay, that's part was understand, Richard. Okay.
Thank you.
Okay. For the mostly things of health, for example, you have a headache or you have a pain in some part of your body, you go to the hospital and have an attention with a common doctor. But if you have, for example, an illness that you need a surgery, it's the same. You don't have to pay nothing. But for example, to complex illness, for example, you need a prosthesis, a cochlear implant, for example, or when all people have a problem in the hip and need a prosthesis, exists an institution that it's called National Resource Fund that pay that treatment that are expensive. And that is for all the people that can pay that things. For example, if you need a treatment, that oncological treatment that is very expensive, these national reserve funds pay that. So all the population it's have a good attention in that part. But the difference of this part that depends on the economy minister, not from the health minister, okay? And this is like the complement of the other part. So in resume, everybody here in Uruguay, including the people who are immigrants, have a good system of health. This system was created 10 years ago. Exists part of this before, but was created there. Okay, the health effectors, o sea, the hospitals have a different distribution. We have private hospitals that have 55.4%, public hospitals and have 34.1%, military hospital that the military have their own hospital that represented 3.6%, and police hospital the same. And we have obviously an insurance private that you have to pay a part of that tax that mentioned, okay? But the people who works usually use a private hospital. The people that who not work use a public hospital. That we are going to see the difference. The difference between the private and the public is in the public you don't have to pay the tickets of medicaments or studies. And in the private, yes, you have to pay all the things when you need, for example, analgesic or antibiotics, or if you want to a special room or a private room, you pay. But that in public hospital, you don't pay nothing. Okay. The insurance it's a little, only 3%. Okay. These are pictures of two different public hospitals. This is Hospital Maciel. That is the oldest hospital in Montevideo. Is in the coast. Is in the port. That the building is very old, but inside it's a modern hospital, and this is a public hospital. This photo is a photo for the operating rooms. That we have 8 operating different rooms. Good occupation there. And this is a photo of another hospital, public hospital, that is Hospital Pasteur. And the building is different from this, but inside is the same. So the public system here functions very well, and the government invests a lot of money for them in the hospital. Not in the salary, the hospital, in the buildings and the things. And we have the university hospital. This is Hospital de Clínicas. It's an enormous building, founded in 1953, and have all the specialties inside. Have 20 floors, and it's very, very big. If you compare with Centenario Stadium, that is here, it's bigger. In that dates, usually make very big buildings and with a lot of floors. It's very similar to Hospital de Clínicas of Buenos Aires. Okay, so these are the representatives of the 3 public hospitals we have here in Montevideo, but in the rest of Uruguay, we have very little hospital that is public attention too, but it's not too big because the cities there are few people who live there. These are, for example, photos of different private hospitals. That the buildings are similar to the others, so there are not a very big difference in the hotellerie, to say in that way, and in the people who work there, because the doctors are the same who work there, here and who works in the others. The difference is the salary we have in these hospitals and the others. But the function and the attention is very similar. It's okay, Richard, do you have any question?
Yeah, let me just make sure. So everybody who earns a salary,
Yes,
pays into the fund based upon 6% or 8.5%. And
yes,
then people go to the private hospitals if they
yes,
if they pay. If they don't pay into the fund, then they go to a public hospital. Is that correct?
yes.
Okay, very good. And then a very small percentage of the population has private insurance, which is a luxury, 3% of the population.
Yes, they have in the insurance, they have, for example, arranged with other hospitals in Brazil, in the United States, and the treatment, they prefer to do the treatment in another country. So they pay money, for example, I think that an insurance of health here costs 1,500 for a year, for example. Mm-hmm. That's what you pay. Mm-hmm. And if you want, for example, if you have money, you can pay for a private hospital that costs $100 per month, for example.
The other,
But yes,
yeah, the other, hold on a minute. My dog's barking. Okay, so the other thing is that it looks like there's a lot of little private, I mean, these are nice hospitals, these private hospitals, but they're catering to that percentage of the population that is paying into the system. And they're getting reimbursed from the government for the services that they provide to the Uruguayans, correct?
no, the system is very well, but the problem, imagine that the function of this is very easy to understand. The Minister of Health pay to each hospital amount of money for each member of associated to that hospital. For example, if we Richard and Mauricio open a hospital, a private hospital, the minister pay to us for each member of each associated that we have. So imagine that it's kind of fight to earn more associated, okay? Because they receive money for each member of the hospital. I don't remember now how much the ministry pay, but they pay for a range. For example, pay more for old people than for children. Okay, but they pay monthly in reason of how associated you have. Okay.
They pay based on the number of people utilizing that hospital per month.
Yes.
Number of patients, okay.
Number of patients. No number of patients that consult. The number of patients you have.
So there's a certain allocation of people to a given hospital for healthcare. Is that right?
Repeat, please.
So in other words, this hospital here in the top corner on the right, that hospital will have a certain number of people that use that hospital. The government says, this is your hospital. This is what you use. Is that correct?
I don't know. You can choose what the hospital you want, because if you live near to this hospital, you can choose this, or you can choose this or other.
Okay.
You choose what the hospital you want. Nobody said, okay, you have to choose this. No. And you can change for hospital, not every year or not when you want. There are like periods of 3 years that open the possibility to change. So you can change to a hospital because you need a better attention with a doctor you want, for example. Because people go to a hospital looking for special doctor or specialty, for example.
Right, but the hospitals get reimbursed by the number of people that are assigned to this hospital, but yet you can change hospitals when you need to.
Is the hospital inverted?
Okay, so let me say, la cantidad de gente, hay una cantidad de gente que el gobierno dice que tiene que usar este hospital.
No.
Okay, I'm still not getting it. Okay.
No, depends on the benefit that the hospital bring to the people. For example, this hospital is cheaper than this. When somebody have to make a scan study, for example, pay here 100 pesos Uruguayos, here 1,000. Okay, they make like promotion or things to earn associated. It's like a competence between business.
Medicine is a business in Uruguay.
No, but these are only four hospitals, but we have a lot of more that these are the biggest. You have others that are small, that have not this building, don't have other things. But there are a lot. And here is in Montevideo, in each department of Uruguay, that are 19, you have other hospitals. And the people there choose, okay? And the ministry pay for the hospital for the amount of associated they have.
Okay.
You understand that part?
Yes. Yes. Thank you.
And the people, for example, if tomorrow you have a cholesterol and you are associated with this hospital or this, the other for public hospital, you don't have to pay nothing. You have the surgery, you have internation, you have well, you pay the medication, antibiotics, analgesic, but you don't have to pay nothing more. For example, if you have a tumor in the larynx, you have the surgery, the radiotherapy, and the chemotherapy. You don't have to pay. You have to pay, for example, when you need a rhinoplasty that is aesthetic. Aesthetic is not included in this kind of surgery. Only tumoral or functional surgeries in all kinds of specialties, okay? But not aesthetical. And for example, heart attack here in Uruguay, it's very expensive, the treatment. We have different points in the city in Montevideo and now in the other departments of Uruguay, and you go there and you don't have to pay nothing because you are in the system. You are in the system. They make the catheterism, the angioplasty, or what you need, and you don't have to pay. And pay that institution that I mentioned, National Fund Resource, pay that surgery, okay? The same, for example, in our area of ENT is a cochlear implant that pay, no, the patient paid that fund. So, but if you have money, you can buy an implant, cochlear implant, you can buy and pay to the surgeon to put, but if you don't have money, you don't have to pay. So that, I think that it's possible because we're only 3 million.
Mm-hmm.
And this, it's very expensive, you know, cost a lot of money to the government for a year, because only with that task is not enough. You have to put money. For a year, I think they put $4,100 per year to maintain this system good, okay? Okay, the other part is the human resources. Here in Uruguay, we have you have the nurses, but we have like the boss of nurses that have another name that I don't found the translation, okay? But for example, in an emergency, the place, emergency, you have the nurses and you have the boss of them that I put the name head of nurse. Here in Uruguay, we have this number of head of nurse and nurse this number, okay? I'm bad with numbers, so see there, and doctors, 13,000 doctors, common doctors. So you have, it's very lot of doctors here in Uruguay, 3.7 doctors from 1,000 inhabitants here. And in comparison with the rest of countries, we see that Cuba is the principal country. For example, United States, it is from 1,100 inhabitants, okay? United States have this number, and Uruguay have this number. But we have a lot of doctors here in Uruguay. I don't know in your countries the number of nurses you have or the relationship, but here is very close. The medical career here in Uruguay, it's for 8 years, and the last years we practice in a public hospital of this kind of hospital job. And you can do it in public university or private. The difference, you have to pay the private. I don't, for a month, I think you pay $500 approximately. In the public, it's free, you don't have to pay. But everybody who receive or finish the career have to pay retirement insurance that called caja profesionales, that you pay all the month. If you work, you have to pay that. So it's like an insurance when you retire. Okay, that this insurance have increased during you are working and you are older. The last scale, for example, is for the last 10 years you work between 55 and 63 years, and you pay approximately $500 per month. Okay, you understand that part, Richard?
Yeah, you pay. So the doctors pay into a fund, a retirement fund. It's retirement insurance. And then when you retire, you get a stipend or a monthly payment during your
Yes, exactly.
Mhm.
And the difference between if you do the career in the public university, you have to pay fund that is a solidarity fund. It's a tax you have to pay monthly for 25 years until the retirement. Okay, this is like the devolution you have to the government of your education. Okay, if you do the career, all the careers, not only medicine, architect, engineer, if they do in a public university, they have to pay this. That's the difference. How much you have to pay is the same, increasing during your career. Okay, but $50 per month, for example, it's not too much. Okay, maybe you have some question of this, that it's very, I tried to simplify it, but it's very difficult to understand that part. Okay, you have any question of this?
Yeah, we understand. You guys have a very good system. Many countries do not have this. In the United States, we don't have a retirement fund for physicians. In the United States, we are responsible for our own retirement. If we do have what's called Social Security, which everybody who works, if you work for a good number of years and you pay into it, you will have some retirement income. But it's not a special fund, retirement fund for physicians. Okay.
No, here it's good. For example, my mother retired, going to retire the next year and have a good retired payment. It's function well. Okay, I'm going to say something about the ENT formation here in Uruguay. It's different from the medical career because the information is only in the public university. you can do it in a private because they don't exist. So you have to go to university public, okay? And the hospital of the university is the clinical hospital that I show in the bigger, okay? And they sometimes you can choose, for example, other hospitals that are public, but they mostly and goes there. The ENT resident program is the same since this date changed from the things, but it's the only program that exists. Okay, it's one only resident program, and our resident program is about ENT and head and neck surgery. Okay, in other countries there are two specialists. One is ENT and the other is head and neck surgery. Here are the same. And for example, somebody who starts the resident can choose for Hospital Clínicas, Hospital Maciel, that were it's one of the pictures that I showed. Hospital Pastel was the other, Militar, and the pediatric hospital that it's Pereira Rosell. Okay, it's only you see only child there. So people who start the resident choose these options they have. And I want to speak only about clinical hospital because it's the most important for the formation. The chairs work there in the hospital and have only one professor, 2 grade professor, 3 attached professor, and 4 assistant professor. And it's like the others teaching career in America that it's very, the salary is very bad, okay? Because the hospital, clinical hospital depends from the faculty, so from the faculty, not from ministry, nothing. So, the money they have, it's from the university. So we are a poor hospital. The admission is for 5 students for a year and 1 foreign student, and the exam is from anatomy, physiology, pathology, and we do usually 2 tests from multiple choice, okay? And the career it's for 3 years, and 1 semester of that 3 years is in the hospital, pediatric hospital. Now we think that we have to add another year because 3 is not enough. And we have, for example, in Hospital Clínicas, how the different activities that in the other hospitals, clinic, specialty clinic, dermatology, neonatology, urology, oncology, emergency and surgical. Hospital Clínicas was in the 50s a regional hospital that a lot of people came here to see the surgeries of oncology. But now it's not a reference. No? But in that moment it was. And the activities we have in the week is the update of patient scene. What means this? We work, all the ENT work on, we see, for example, patient on call at home. So when somebody calls from the emergency, you go there, you go to the emergency and see the patient. So on Monday, the resident said what patient see in the week, okay? The Tuesday are the surgical day. Thursday, discussion of cases, the difficult cases. And on Friday, a clinical class with a patient. And that is the activity we do normal now. This year was not normal for the pandemic situation. So change a little. And the courses we do usually is the otology, temporal augmentation, and sometimes the radiology endoscopic surgery. But the otology, temporal augmentation we do usually. And the evaluation we have 5 writing semestral exam. When you finish the semester, you have a written exam, and the last is oral with the patient. And the final exam is a part of oral exam with a patient and a surgery. Okay. You have any question, Richard, of this?
Yeah, Mauricio, do you have fellowships? Do you have fellowships after your 3 years of ENT training? You have
No.
You have fellowships?
No, we don't have fellowships. No. We have foreign residents that came from Ecuador a lot, from Guatemala, from that kind of countries, but fellowships, no.
Okay. And then how many ENT doctors do you have in Uruguay?
This is the next.
Okay.
Population of ENT, we 160 approach. And most than a half live here in Montevideo and work here. The others work in the other departments, okay? But maybe more than 100 work here in Montevideo. And the system of work of our work is different. We work a lot on call at home in the different hospitals. We have regular consultations. In general, we have 2 hours with 10 patients, and scheduled surgeries is the common. And the difference between a private hospital and a public hospital is the salary. In public, it's fixed. It's the same. You make 10 surgeries of adenotonsillectomy or 10 surgeries of tumor or melanoma acoustic. Is the same. The salary is the same. In private hospitals, they pay for the things you have done. For example, a surgery pay, a consult they pay. It's not fixed. But you can work in different hospitals. You don't have to work only one. You can work in 2, 3, 4, what you need, what you want, okay? Because here is small. This hospital is very near one to the other. So you can go to one and then to other. These are difference between another countries. Do you understand that part, Richard?
Yeah. Anybody have any questions? Most doctors work in public and in private, or just public?
Mostly work in both.
In both? Okay.
Yes, because for example, I work in 2 public hospitals and in 3 or 4 private. My case, for example. When you start, you need a work that allow you to do surgery. So you try to choose a public hospital. It's easier to do surgeries. So everybody wants a position in a public hospital. It's easier to do surgery. But this number is too much for us.
Well, if you divide the number, if you take 100 ENT doctors in Montevideo, population 1.5 million, it comes to about one ENT doctor per 15,000, which is much. In the United States, it's one per 25,000 to one to 30,000. So you have twice as many ENT doctors in Uruguay as the United States per ratio of people. Okay. So you need to quit training. You need to accept 3 doctors per year and not 5 for training.
Okay.
You need to cut down on your training. Otherwise, you're going to have too many ENT doctors in Uruguay.
No, but the problem here is that it's very difficult to somebody who start to the surgeries, to access to do surgery. Very difficult. That is the same, I think, that in the other countries in South America. Because the old ENT do the majority of surgery because they pay. Because it's pay for each surgery, okay? So it's very difficult for us. But, well, I don't have any more things. That was the last.
Okay, Mauricio, thank you very much for your lecture. Does anybody have any questions? Remember, Uruguay is a small country, 3 million people. Okay, that's the size of most cities in a large country. The whole population, half the population lives in Montevideo. The rest of the country, even though it's not a large country, you have another 1.5 million. The ENT doctors are spread. Half of them live in Montevideo and half of them in the rest of the country, for which there's 19 different departments. And there's a lot of ENT doctors, relatively speaking, for such a small country. Mauricio, how many doctors do just otology? Only otology. Otology.
Oh, 6 or 7 only.
Okay, so 6 or 7 out of 180 do otology. How many neuro-otologists? How many people do, advanced skull base and acoustic neuromas?
No, acoustic neuroma here resolve the neurosurgery.
The neurosurgeon does all the acoustics in Europe. Okay.
Yeah.
So in Uruguay, the ENTs do not do it. So if they're being done by neurosurgery, then they're doing retrosigmoid or middle fossa. They're not doing translabyrinthine approach to acoustic neuromas.
No, but the problem here is that we are only 3 million, and it's very difficult for somebody to learn that technique. That is very difficult because we don't have enough cases. Maybe that I am a otologist and I see for a year 1 or 2 only, or 1.
Right. They estimate that there's one acoustic per 100,000. Okay, which means that would account for maybe 30 if you diagnosed everybody and everybody got tested, you'd have maybe 30 cases a year. But again, we're not testing everybody. Not everybody who has an acoustic needs treatment, surgical treatment, that is, gamma knife or watching and waiting. So it's a you're one of 6 that see that does ear surgery. So that would figure 10 patients in the ENT community that sees it. But the real situation is the neurosurgeons are the ones that do the acoustic surgeries in Uruguay. It would be nice to get somebody like yourself to get training to do translabyrinthine approach in those patients who you can preserve hearing. Okay.
Okay.
So
no, but here, for example, neurosurgery with they operate the big, bigger, but the smaller they do radiotherapy, intracanalicular melanoma.
And do you have how about otosclerosis in Uruguay?
Otosclerosis we have a lot because in the Second War, a lot of Spain and Italian came here, so it's
Right.
full of sclerosis.
Right. Okay. So you have a fair amount of otosclerosis. What about cholesteatomas?
Cholesteatoma, a lot of cholesteatoma.
A lot of
because because in Montevideo, but in the other departments, the ENT when see kids with big
type
no, big amígdalas, como es tongue,
amygdalas.
okay, well, they don't do the surgery on when because nobody pays, so the kid grows and somebody they have problem in the ear, and it's full of cholesteatoma here.
Okay, so there's a lot of tube dysfunction, probably from lack of treatment of enlarged tonsils, adenoid tissues with secondary eustachian tube problems. So
yes, for example, and we have the problem or the typical problem of in public institution that we have time of waiting of 2 or 3 years because we can't operate. We don't have a place. We don't have hours.
right.
We have a lot of surgery, oncological surgery here because the smokers here are a lot. So the year passed to another place.
And what about the equipment? Your equipment in hospitals, is it mostly like, do you buy Brazilian microscopes? Do you buy German microscopes?
No, we have good microscope size.
Okay.
We have good endoscope. No, the material is good.
Okay. And then are your most of your surgical instruments from like stores or Medtronics or do you?
Medtronic, we don't use Medtronic here. We only use stores
Okay.
and stores, but Medtronic no.
Okay. Let me ask you a question. Many countries today, many countries purchase Chinese instruments, Chinese products. Okay. Do you do that in Uruguay very much? Is there a lot of Chinese imports into your country?
Now I import. For example, I bought when I went to Congress and to other countries, but import is impossible here because to import medical products here is impossible.
It's very expensive.
No way.
Is that because of the taxes on the importation?
No, not for the taxes. It's for because it's forbidden because it's a product that is medical. The the customer is stay there. If the product says medical, no pass. And stay.
You're using Carl Stores and Zeiss microscopes. That's very good equipment. So
No, the equipment is good.
mhm.
The problem is that we don't have enough hours of surgeries. The operating rooms they give to surgical, traumatological, urologist, and after that ENT, and first the oncological pathologist, and after ear disease.
You need to create an ENT a private ENT hospital.
We don't have a private ENT hospital.
You need to form a private ENT hospital where you can get more time and just do ENT services.
Okay, of course, but
If anybody has any questions, please put them in the chat. Oscar from Ukraine, which is right next to Uruguay in the alphabet, usually has questions. Either put a chat question in if anybody has it. Oscar, what is your question for the day?
Oh, thank you, but I don't have any questions for today. It was very clear, so thank you for the presentation.
Thank you, Oscar, for your short comment. Does anybody else have any comments?
Richard, I'm Nestor.
Yeah, hi, Nestor.
I would like to say hi to Mauricio over in Uruguay. It was a very nice presentation as well. And I believe that as we do in Paraguay, because we are small countries, we had trouble getting the training in very rare cases or perhaps very complex cases, such as neuroacoustic fibromas. And so in our countries, also the neurosurgeons do that. I don't know any otologist here in Paraguay who does that. So I believe Uruguay is better in terms of healthcare systems, but because of the amount of the population, we are very similar to them. And once again, I would like to say hi to Mauricio and thanks him for his presentation.
Thank you, Nestor. Okay, anybody else have any questions or comments they'd like to share? Okay, well, if not, I'd like to thank Mauricio for his lecture. It's always nice to understand healthcare systems. I think the major advantages to Uruguay is that, first of all, they have their education standards are on par with the rest of South America, if not other countries of the world, but their small population allows them, as does Paraguay, to have more control over their healthcare system. You know, when you get into populations like Brazil, which has 220 million people, and the country is larger than the United States geographically, you lose control, okay? But when you have a population of Uruguay, which is, you know, the city I live near is Seattle. It's, you know, the city's 1.5 million. With, if you take the surrounding areas and the whole state I live in is 6 million, I'm just in one state in the United States. Our population in my state is double the population of the whole country of Uruguay. So having a small population has significant advantages, especially when you're delivering healthcare, because you can control it better. And I think that this is a good example of what Mauricio shared with us. Well, listen, if nobody else has any questions, I'd like to thank you all for joining us. Hopefully next week we'll proceed with another lecture. And if there's any questions, please put them on the forum. And thank you all for joining us today. Mauricio, thank you again.
Thank you very much.
Okay, everybody. Have a good day. Thank you again. Bye-bye.
Thank you.